Hello, I'm Vaughan Gething, Policy and Learning Manager here at THET. I'd like to welcome you to this final session of Day 1 of the THET conference. I'd like to introduce you to our keynote speaker who will close the first day of this year's THET conference before he then rushes off to open the Wales and Africa Health Links conference. Vaughan Gething was born in Zambia, brought up in Dorset, and was educated at Aberystwyth, Cardiff University. Vaughan's a member of the Cooperative Party in Wales, and in June 2013 was appointed Deputy Minister for Tackling Poverty. Since then has taken on increasingly important roles in the Welsh Government and is now the Minister for Health and Social Services. Personally, I'm delighted to introduce you to the Minister for a number of reasons. Firstly, THET is on the board of Wales and Africa Health Links. Delighted that our two conferences complement one another this year over the coming days. But of course, THET's links with Wales go right back to our origins. Then rushes off to open the Wales Harry. And as head of policy and learning team here at THET, I greatly value the distinctive approaches each of the four nations are taking to the development of a more globally focused NHS, which really recognises mutual benefits. I've also been a keen observer of the Welsh approach over a number of years, and I think it's remarkable to see the progress made in Wales. A particular highlight for me was the launch of the NHS Wales Charter for International Health Partnerships, now marking its 6th year, I believe, which really cemented a commitment from the Welsh Government and Welsh health organisations to support the international health agenda in Wales through joined up intelligent policy making. Of course, over the last few months, it's been truly heartening to see the overwhelmingly positive response of Welsh Health Links to support their friends and colleagues in sub-Saharan Africa as the pandemic develops. Minister Gething has, of course, been personally associated with all of this and more, especially since he was appointed Minister for Health and Social Care, and has made regular visits to see the impact Welsh health partnerships have made. For all these reasons, it's therefore a great pleasure to introduce Minister Gething on behalf of THET and on behalf of Wales and Africa Health Links. I'll now hand you over to the Minister to give a keynote speech, to be followed by a chance to ask questions. So do pop those questions in the chat and Q&A functions of Zoom, and we can have the questions at the end of the Minister's keynote. Thank you, and over to you, Minister Gething.
Thank you, Graham. And thank you for the opportunity to address the Tropical Health and Education Trust's annual conference. Much easier to say THET than that particular mouthful. And I'm pleased to be able to join you virtually today. Given the ongoing position we find ourselves in, I think it's entirely appropriate we talk about not just the challenges that we face, but actually the challenges in other parts of the world. We are fortunate indeed to enjoy the foresight of previous generations to have a well-developed and well-funded health and care system. As the Cabinet Minister in the Welsh Government for Health and Social Services, I remain fully committed to achieving sustainable development and prosperity for all, within and beyond Wales. I want us to continue to work in partnership across sectors with other countries, regions, and international organisations. The importance of our engagement on the world stage has never been clearer or more important for the Welsh Government. Our Wellbeing of Future Generations Act from 2015 provides a clear legislative framework for sustainable development and our contribution here in Wales to the UN Sustainable Development Goals. The Act helps us with a legal framework to support international engagement, which in turn can make valuable contributions to the number of the national wellbeing goals enshrined in the Act, including a healthier Wales, a prosperous Wales, and, importantly for today, a resilient Wales. Importantly, the Act also explicitly places a globally responsible Wales as one of the 7 goals for the Welsh public sector. Our international strategy demonstrates a clear commitment to play our part in the global community and sets out the ambitions of Wales for a strong international presence through 3 core ambitions. The first is to raise Wales' international profile. The second is to grow the economy by increasing exports and attracting inward investment. And the third is to establish Wales as a globally responsible nation. Wales has a proud tradition in relation to supporting global health. including the considerable contributions made through our Wales for Africa programme. And that programme has enabled many NHS Wales professionals to develop partnerships with sub-Saharan Africa and other developing healthcare systems. Linked to that programme is an active network of professionals in Wales who work to progress the health and development agenda, often on a voluntary basis. Our Charter for International Health Partnerships that I published in 2014 was refreshed and signed again by all health boards and trusts last year. It commits NHS Wales to follow good practice and ensure sound governance and organisational responsibility, and importantly, to continue to develop reciprocal international partnerships. And those are partnerships that provide value not just to the countries we partner with, but I firmly believe provide real value to us here in Wales. Now, a few years ago, I had the privilege of visiting Mbale in Uganda as part of the 10-year celebrations for our Wales for Africa programme. It was amazing to see firsthand some of the projects and partnerships that we have been supporting. Mbale has one of the greatest concentrations of Wales for Africa youths, and they provided a value opportunity for me to see several of the links between our country and that region of Uganda in action. And Mbale really is a beautiful place, but the roads are poor, the climate is changing, and life for many people is extremely hard that many people in our country would not recognise. I visited many places in Mbale, including health centres, a regional hospital, and schools. I met with many volunteers from Wales involved in a variety of activities, along with 6 people on 8-week placements through our International Learning Opportunities programme. I did see some shocking things. Threadbare and stained foam mattresses in a desperately under-resourced healthcare centre where women gave birth by torchlight, a 6-bed delivery suite in a hospital that serves a population the size of Wales, struggling to cope with women in labour, sometimes as many 50 in one day, and seeing people queued up outside. An enormous smouldering pile of clinical waste that was dumped at the back of the same hospital because the incinerator was broken. I'm sure that many of you here know only too well that these are things that are sadly not uncommon and still part of the stark reality of life in many of the poorest regions of the world. But I also saw great hope. Wherever I went, I saw evidence of people from Wales working alongside local people, making a genuine difference. I met 3 extraordinary young men from Carmarthenshire working with engineers for overseas development. I didn't really expect to hear the Carmarthenshire accent on the tour, but they were helping to build a desperately needed maternity unit in rural Kachambala. An electrician, a plumber, and a carpenter working alongside Ugandan workmen. I visited a dozen or so volunteers from Wrexham-based Teams for You, engaging a whole school in learning about sexual and reproductive health while testing everyone for HIV. I attended a workshop, one of many, training a total of 1,500 volunteers from across the region in community health and hygiene promotion. Those volunteers play a vital role in helping to prevent and control outbreaks of diarrhoea and cholera. At Mbale Regional Referral Hospital, I saw improved neonatal care as a result of training from Wales. And I saw the amazing motorbike ambulance service for the entire region, devised by volunteers from the Welsh Ambulance Service, supported by PONT and district councils of the Mbale region, with money from UK Aid and the Welsh Government. So during my short visit, I was able to see just a few of the projects supported by Wales in Mbale, but I'm aware that we have supported more than 500 projects across 25 countries in sub-Saharan Africa, originating from every part of Wales. There were some difficult things that I saw that will stay with me for the rest of my life. But I can attribute to all of you and the many thousands of people, not just from Wales, but from further afield, that volunteer to help to make the world a better place through international partnerships. But this isn't a one-way street. The learning we gain from these partnerships is considerable, and many of our staff return with extra motivation and empowerment to make a difference with and for NHS services here at home, as well as their continuing wish to continue making a difference in the parts of the world that they have visited and taken part in. The COVID-19 experience has reinforced the importance of international cooperation and partnerships going forward. Developing strong relationships and learning from others has never been more important. During the pandemic, Wales has continued to demonstrate our commitment to being a globally responsible nation. For example, I was delighted to be able to give 50 CPAP devices to the Department of Health in Bangladesh to support their efforts in tackling COVID-19, which will also assist us in Wales to conduct a parallel clinical trial. The Welsh civil society engaged in international development partnerships have risen to the challenge to do what we can in solidarity. The ways of working have had to change as we've all had to adapt to and embrace more digital ways of working. The pandemic has necessitated the exploration of how we can move away from a traditional model of exchange visits with multiple flights to a more carbon neutral approach. I know that many links were already using digital methods to support their capacity building training and support, but the pandemic has accelerated this with a multiplicity of platforms and methods now being used. This, of course, brings other challenges to new ways of working. For example, the need for reliable Wi-Fi coverage and a dependency on mobile phones. That said, reception in Africa can sometimes be better than in some parts of the UK. Preconceptions, too, will need to change. The challenge to all of us from the Black Lives Matter movement is to consider how conscious and unconscious remaining attitudes from our past and our colonial hangover can affect what we do and how we do it. And we need to truthfully examine our motivations and consider any unintended consequences. And in many ways, the way in which we try to change healthcare here in Wales, not to do things to people, but to do things with and for people and to empower them, is hugely important in the way we engage our international work as well. But our Wales and Africa grant scheme has also changed its focus and announced its final round for this year of over £160,000 would be used for a COVID-19 emergency fund. Many health links have been successful, and their applications are more than £800,000 worth of projects, which demonstrates the continued willingness of people from Wales to actively support friends and communities, people they have never met in sub-Saharan Africa. Some examples of our new and repurposed projects include the provision of PPE, soap, sanitizer and hand washing facilities for healthcare workers, funding and the provision of guidance for local level training alongside webinar support, an online staff wellbeing service for senior doctors based on a model we've created here for NHS Wales staff, and help to redesign a hospital to enable COVID-safe surgery to continue. I'm particularly keen that the potential of NHS Wales to engage in and benefit from international health partnership activity is fully explored and maximised. I know that we continue to explore potential new opportunities that will enable an even greater number of quality exchanges between Welsh healthcare workers across borders. Finally, I'll be delighted to launch the Wales and Africa Health Links Conference, which I know is hosting a series of free-to-access fringe online events in the afternoons and evenings during the THET conference. It is great to see this joined-up approach to international health partnerships. These fringe online events are our annual celebration of the health links between Wales and Africa. They always provide a great opportunity for us to come together, to learn and to share our different experiences. I know that you, as ever, have a stimulating programme to look forward to, and I hope the next few days will provide you with an even greater motivation to make a difference. Our belief is that here in Wales we have much to offer as well as much to learn, and now is more important than ever to continue to do so. Thank you once again, and enjoy both conferences, and I look forward to a brief series of questions before returning to the rest of my day.
Thank you very much, Minister Gething. Pleasure to hear your vision and values for Welsh global engagement and how Wales is creatively responding to the challenges of the pandemic, along with your powerful personal testimonies. As you say, we do have time for a couple of questions. Perhaps if I could begin with one question. You mentioned that you've refreshed the Charter for International Health Partnerships. What do you think what do you feel that the longer term sort of legacy of the Charter will be?
Well, I think the longer legacy will be to embed our way of working. You know, we not just in sub-Saharan Africa, but we have a really high profile within the World Health Organization European Regional Network as well. And I think we gain an awful lot from that. As I said before, these aren't one-way sort of information provisions. We really do have people who are much more motivated as a result of it. And frankly, we learn new things as well that we can apply here too. And what I think, though, is those three goals that I set out in our international strategy, they've all got equal standing. And I really do think it'll embed in a much wider group of people this sense of Wales being a globally responsible nation by choice. And that isn't just a pat ourselves on the back for doing a good thing, but I actually think there's real benefit from it. And I do think that we'll see that international work not as a nice to have, but as a key part in learning and development for ourselves, as well as our mission to be a globally responsible nation. So there is always a risk, as we've seen in the last few years, that the progress you think you're making get turned over. And people can then want to say, we only want to look inward and we don't want to look outward to the rest of the world. We don't want to share, and we think that other people are taking advantage of us. I actually think that it is entirely in keeping with the spirit of the creation of our National Health Service and the mission and the altruism of our staff. And I think that we'll see that reinforced. And to remake that case and that mission, and the challenge will then be how we take what is an internal healthcare conversation in many ways with highly committed volunteers and to have a much greater purchase within the wider community here in Wales for everyone to be proud of what we're doing, rather than the question, why on earth are we helping people that I've never met before? Well, we help people we've never met before all the time in our own country. And we should think of that as part of our mission if we truly do think that we should be a globally responsible nation.
Thank you. Now, we do have a couple more questions from the audience. One on COVID. How can the SDGs be linked to our recovery and building back better? The SDGs get mentioned so rarely by English or Welsh politicians, yet the agenda is right there, is the question. So, a challenge.
Well, I think building back better is an opportunity to look back at why we committed to those goals in the first place. And in Wales, they're embedded. So we made a deliberate choice to embed them in our approach in the Future Generations Act. And they're reinforced in our international strategy. So we have never abandoned them, never forgotten them. And you see this sometimes in community links. So I'm very fortunate to represent Cardiff South and Penarth. We've got a very wide and varied history. Like many other port cities, Cardiff has had and benefited from people from around the world. We've benefited economically from where those people have worked, and they've changed our city as well. But fundamentally, they've changed our city and our country for the better. And that's the point. And you get to well, people no longer see you as someone else, but they see you as, well, that person is proud of their Greek Cypriot or Irish background. Our challenge, though, is that there are still people who are visibly more different, where we haven't moved that level of not just acceptance, but then pride in the fact that we're different. But lots of those communities have never forgotten they have multi-heritage. And so the development goals are really important for them. And it was a deliberate choice for the government and indeed the Assembly, as it then was now in the Welsh Parliament, to embed those in a piece of legislation. So I actually think that we have much to offer other parts of the UK in making sure the development goals are not lost. And again, we should take pride in the fact we're deliberately trying to achieve them, to play our part in doing that. Wales is a small nation, but I think we have lots to offer. And we can't expect other people in other parts of the world to do their bit if we're not prepared to do ours. And that, again, goes back to being a genuinely globally responsible nation.
And talking about the other parts of the kingdom, as development is not a devolved function, how will the Welsh Government engage with FCDO now that the Department of Health and Social Care has more development budget as well?
Yeah, it's part of our challenge. When I was in Bali, I had a reception at the end at the High Commission office, and we met people from the then international development team, and it was a real sense of frustration that there wasn't a more deliberate attempt to engage with what we were doing with Wales for Africa. And rather than seeing us as competitors to avoid or ignore, that actually there'd be a lot to gain from working alongside. It's not that we don't make deliberate efforts to want to engage in UK government machinery. It's about how open-minded we are, about how we get to add value, because we're engaging in lots of community-level projects and assistance that is making a difference where it is, and I think we'd gain more from that. And in terms of that, some people are a bit obsessed with soft power. But actually, if you want to have influence and be listened to, then the way that you work with others, I think, really does matter. And I actually think that having an approach where communities can see that you're generally working with them and not simply saying, I'm now here to tell you what to do, I think is very, very powerful. So we'd want to see further improvement and improving and increasing openness for UK government departments to work alongside other parts of the United Kingdom in the work that we do, because I actually think that we'll all gain benefit from that.
Right, and thinking back home, how does the need to focus on COVID-19 at home and the strain on the NHS impact the way Welsh government views global health volunteering?
Well, I said we had a direct request from the Bangladesh health minister for to see if we could help with these CPAP devices, so that are oxygen therapy, but not intensive or invasive ventilation. And the results have been pretty promising. So we were able, because we'd had a manufacturing challenge, we created a number of devices, and they're actually relatively low cost, the ones that we created. We're able to provide those. And that, as I said in my opening, was, there's part altruistic, but also there's a very practical benefit, because we're able to see and to compare a clinical trial in another country, in another context. And we will almost certainly learn from that as well. And again, in terms of the motivation, we regularly have people who help other parts of the world in doing that too. So I previously attended events where there are Welsh Bangladeshi doctors who regularly raise money, who regularly organise trips to go and provide training and support for the healthcare system in Bangladesh. And it's hugely motivational for them and their practice here in Wales as well. So we're gaining a deliberate benefit from them. So those health links are a direct benefit. And the reality is that we're not doing those because we have this sort of cynical bargaining position of, we'll help you with healthcare provision if you look favourably an investment on us. But it's that point about when you have regular and trusted relationships, it matters in more than just the healthcare field as well. So I do think that it will reinforce the need for international partnerships, but international learning, because as we saw the pandemic spread across different parts of the world, we've taken learning from other parts of the world, and as we go into this next phase, we'll look at what's happening in other countries, especially in Europe, but further afield too, to understand the spread, to understand what's effective, to understand how we help each other, because actually if this pandemic is uncontrolled in other parts of the world, it'll continue to affect parts of the world. For example, if a vaccine is only maintained in the Western world, that'll be a really big problem. It'll affect our ability to have trade and more normal relationships with other parts of the globe too. So it's in our interest to see a genuine international focus on how we not just combat COVID, but then the joining up of our healthcare world after that as well. So rather than this undermining the role of organisations like the WHO, I think it reinforces why they're hugely important for all of us to keep us safe in this country. We need to take an interest in others in an open-minded and generous way.
Well, thank you once again, Minister Gething. We're running out of time, so thank you from FET and Wales and Africa Health Links for your keynote today. As I mentioned, the Minister's speech both concludes the first morning of our conference here at FET and opens the Wales and Africa Health Links Conference. And of course, the Wales and Africa events, which follow over the next 6 days, I believe, will be a fantastic celebration of the role Welsh Links play in global health, and we're delighted to be running the events side by side this year. All of the sessions are detailed in the agenda on the Hubelo FET conference platform with links to click through and join. So goodbye, and thank you once again.